Cool. I think we're rolling. All right, welcome back, everybody. Dr. Steve Oswald here, physical therapist, diagnosed by the sports PT. Today's topic, we're going to be talking knee arthritis. Super common. If you're tuning in, you're either experiencing it yourself or you know someone that may be experiencing this as well. Chose this topic. Again, most of our topics that we've chosen are things that are really prevalent, really commonplace in society, so that we can just reach the majority of you guys that are experiencing these issues. Knee arthritis is one of the most prevalent musculoskeletal issues that's out there. It's the most common reason for knee pain, just period. And there's a lot of modifiable risk factors that are associated with arthritis that require some management, which is why it's valuable that we have some discussion about it, because although it is common, there are many things that you can do to manage and then prevent the onset of arthritis-related issues. We do know that a good portion of arthritis is related to genetics, so you can thank mom and dad for some of those issues. I think somewhere between 40 and 60% of it may be due to genetics, so about half of the development and progression is due to that, but everything else is really modifiable. So in that instance, lifestyle, the forces that we're putting onto the knee, those can all play into how you feel with your knee and the things that you get back into. There's a lot of myths that go around arthritis in the knee specifically that I want to attempt to address today, specifically with the types of activities that you can do safely. But I want to give you some tools today if you are experiencing knee symptoms that are just simple, easy go-to activities that can be helpful, and then have a further discussion about other things that you can do in addition to what we're going to do today. So first and foremost, let's just dive into exercise, right? Most people are here for exercise in this instance, right? So I've got 3 specific things that I want to do today that all in a different way address different components of the knee that may be affected by arthritis. So whether we're addressing joint stiffness, the ability to get the knee all the way in a straight position, which oftentimes is lost, especially in moderate severe cases, and then doing things to ease those symptoms. Again, if it's painful, there are certain positions you can put the knee into that can temporarily at least reduce your pain. Okay, so without further ado, let's dive right in. Okay, we've got Kelly. She's our model today, right, from our McMillan clinic. So Kelly's going to be, in fact, Kelly experiences knee issues too. So not to talk too much about her history, but this will be good stuff for her today too. We are going to go over, again, 3 exercises. One of them is going to be what we call a quad set, like a quadriceps set. The second is what I call an extension challenge, right, where we do a sliding motion and again straighten out the knee. And then the other will be a gapping technique for the knee, so it kind of unloads it, and we'll use a towel roll to assist with that too. So if you don't have a towel roll handy, maybe grab it here in a moment because we'll use it for demoing with this one. So these are our 3. I'm going to have Kelly lay down on her back, okay? And we are going to do our quad set first, right? Now, there's a couple ways that you can perform this exercise. When we're first learning it, I like the concept of having a towel or a t-shirt or something small and soft rolled up like this and popping it back behind the knee like this. That gives you kind of some sort of tactile or feeling of feedback with this exercise when we perform it. Because what we want to do is, from this position, think about squeezing that quad muscle, that thigh, in attempts to straighten the knee out, and you're pushing the back of your knee down into that towel, right? Almost forcing that hyperextension position. And it is okay if you do hyperextend somewhat with this exercise. When we do this, the length of time that you hold does matter. Oftentimes this exercise is done relatively briefly, but what we know with some of the literature surrounding exercise programming for knee arthritis specifically, some of the better programs suggest holding this near maximally, as long as pain is tolerated, for up to 10 seconds. So doing long duration holds where you're holding 6, 7, 10 seconds in duration and doing roughly 10 rounds of that with that frequency has good benefit. So we're holding that, we're squeezing near maximally, you're holding hard, 10 seconds, which is super boring, right? But if you are squeezing near maximally doing that, 10 seconds, 10 rounds of that, 100 seconds total time, you're going to get some fatigue in your quad. Again, I don't care how strong you are. If you're doing this thing maximally, you're really pushing into it and you're going to tolerated levels, this is going to work that quad muscle hard. So that's important because what we do know is that your quadricep muscle strength is directly proportional to the severity of the symptoms, at least that you feel. So pain and function is related to that quadricep strength. So getting that quad strong, especially near its end range of motion when your knee is all the way straight, is important, is critical, okay? So this exercise can be progressed. Again, I like moving away from the towel behind the knee. Once you kind of get the understanding or idea of that pushing motion where you're trying to flatten the towel out and pushing the knee down, I like to move it at this point to down underneath the heel, right? So now what we do is we've elevated the leg a little bit. We have more of a gap underneath the leg now, and so we no longer have the towel blocking this spot, so you can move a few degrees further into that motion, and you're still getting that squeeze, but now you're more truly near that end range of motion. Same parameters, right? So holding firmly, okay? So this is very simple, but again, things don't have to be complex to be effective. So if done well, if done with the right vigor and held for the appropriate amount of time, this exercise can work very well into establishing that end range of extending, which is critical, especially if you have symptoms with standing for a long period of time. If you don't have your knee in an all the way straight position, you can't get it all the way straight. Every time you're standing on it, you're putting extra stress into your knee because it's trying to buckle, and that quad muscle is having to work extra hard if you can't get the leg all the way straight. So we want to get it all the way straight. We want to work it at that end range of motion. So this is our quad set, okay? The second exercise, again, we call it an extension challenge. It's similar in concept to that quad set. In fact, you will do a quad set with this exercise, but we want to initiate some motion, right? Because what we do know about arthritis, not just in the knee, but in any joint, those joint surfaces are lubricated and they get their nutrients through synovial fluid within the joint, and that imbibes and it becomes lubricating to the joint with motion. So we have to have motion in the joint to keep those nutrients flowing and make sure that tissue is well nourished, right? So motion is going to help reduce some of the stiffness, but we still get that quad muscle activation with this next exercise. So this one, we want to do a heel slide motion. So we're pulling the knee up, sliding it, on the table. We've got a few bumps on this one, so if you're doing this on a bed or a couch or floor, you won't have the same hang up, but we're pulling in, and we're not going necessarily to all the way bending. We'll get to bending in just a moment, but so just kind of halfway, and then extending all the way out, and then you're doing a quad set here at the end. But what's a little bit different than the quad set that we just did before to really get into extension, think about extending your heel out, so you're pushing your heel out this way and getting your quad set, and that really moves heavily into that extension position. Hold this for about 3 seconds, then relax, and then repeat through that motion. Slide again up, and then pushing it back out, extend, push the heel out like you're making your leg extra long, and then come back in. Again, roughly 10 repetitions of this too. As you trial, quad sets in this one, doing 10 rounds of it. If you're not having any soreness or negative consequences from that, you can do multiple sets of this too, but start with just 10 and see how you feel. Okay? So just that simple, right? There's no major progressions or regressions of this one. This is just a good oscillating exercise to get some fluid motion into the knee and then working into that extended position. Okay. Our last exercise is going to be for that gapping, so kind of opening the knee joint up itself. This tends to be a really effective exercise if you're having some symptoms to just temporarily calm it down, because of the way it kind of opens the joint and reduces some of the compressive forces inside of the knee joint itself. Now, oftentimes when we think of stretching, we think of just kind of taking a muscular joint and kind of putting stretch into it. And there's a big difference between what may happen in the joint when we stretch it, or if we add something to kind of gap, which is what we're going to do with our towel roll with our knee in a bent position. So we're going to kind of bend the knee here. Okay. I'm going to take my towel roll, I'm going to pop it back behind my knee like that. I'm going to bend it around it, and I'm going to try to bring my knee up to my chest like this. Okay. With my hands, you're going to hold, ideally as far down the leg as you can. I understand, maybe tough to get up into this position for any number of reasons. If you're having trouble bringing your knee up to your chest like this when you're laying on your back, enough to kind of wrap around your leg, you can have like a belt or a loop or towel or something where you wrap it around your ankle and you hold on to that towel and you can pull into it as well. So I'll show you that modification in a moment if you can't get that visualization. But you do want to be as far down as you can. And what you're going to do is just pull, kind of hug that leg in towards you where you're trying to bend the knee as much as you can. But having the towel roll behind the knee does change some of those joint forces in the knee because it's acting like a fulcrum. So now when we bend the knee like this, it attempts to kind of separate those joint surfaces a little bit because it's kind of wedging around it. If we did this without, right, and if you try it without it, you'll notice a big difference. Now we can get a little further in that motion, but we don't have that fulcruming effect, and we just stretch that tissue, and we, in some instances, can compress a little bit into the joint too. So it's not much, but you do notice, again, this is just moving into the stretch here. This can help to often reduce symptoms. So there is a subtle difference. Try that. If you are having, again, if you can't hold, I'm going to grab a belt real quick. If you can't hold that position, you can imagine this is our belt. Okay, just take a normal belt, right? Loop it through like that. You can either wrap it just around your foot itself or the ankle. We're going to go with the ankle like that. And you can hold on to it here, just underneath. We want to bend. And then just keep the belt low, right? And we do want the belt to be on the inside, right? That's going to, again, because there's going to be a subtle amount of torque, like twisting, because it's on one side versus another. So if you have it on the inside, it tends to gap the knee a little bit healthier than the other way. But this is your modification, right? Where keep it real low, pull that way, and towel behind the knee. This feels real good. In fact, most patients, when they first try this, they can't stop because it does feel good. It temporarily reduces some of those symptoms. Again, it doesn't cure your arthritis, but it does buy you a window of opportunity where symptoms are a little bit less, so you can improve your level of activity, walk a little further, stand for a little bit longer before symptoms onset. Plus, it's helping to ensure that you have adequate joint motion that's there too, because if we don't have full motion, the joint itself tends to be more stiff and more limiting with what you're able to do. So those are just 3 simple exercises that you can do that address a lot of the primary issues that come about as far as symptoms. Where we don't have good motion, we have stiffness, we have pain that limits your motion. What's critical with knee arthritis is restoring as much as possible that quadricep muscle strength. So there's any number of different exercises that you can do to increase the strength of your thigh. Some of it's in the gym. What we do know though is through the research and through the clinic that doing functional training such as squats, stair stepping, body weight exercises is more effective for both pain reduction and improving your physical function. So when we take physical function scores, you do better with those type of exercises than you do with machine-based activities. So thinking your leg presses, knee extensions, those things can be helpful in isolation, but they don't seem to be as effective as squats, lunges, steps. So that does beg the question that we get all the time, which is doing squats and lunges okay? You know, I've been told I should never do those again. That's again, it came up before in our last knee course. That's old news. Again, we've known for at least 15 years now that the compressive forces around the knee, with even a deep squatting position, are satisfactory and fine to perform, and they don't increase the risk, incidence, or severity of arthritis. In fact, there's a lot of evidence to support that it's preventative and protective with those joint surfaces when performing resistive squatting specifically. So it's very much safe. It's effective to do, and it will actually likely help with your pain and functional if you do them regularly. What we do know is it has to be done regularly with knee arthritis specifically. If we're doing things regarding exercise to improve your pain and function, it's going to take time. It didn't happen overnight. It's not going to be fixed overnight either, and that's true of any specific intervention, even outside of therapy. Roughly the timeframes that we see in the literature and then what we experience here in the clinic is kind of 8 to 12 weeks of a consistent program. And what we know, again, specifically from the research, and this matches what we typically see here in the clinic, is that you have to do it at least twice a week. What they found is that one time a week of doing exercise specifically for knee mobility and strength didn't cut it. We didn't see any effect from that at 3 months down the road. However, a twice a week frequency, so just literally going from once to twice, saw a large effect size for improvements in pain and function when doing the things that we talked about. So expect it to take a little while, but it can be quite helpful literally going in and doing exercise therapy to reduce your symptoms. One of the things we haven't talked about that is important and it's related to activity is managing weight. And again, we kind of dance around this topic a bit in medicine and health in general, but one of the strongest predictive factors of a high severity arthritic knee and hip is high BMI. And that's true of whether it's body fat or just mass, period. So because the body doesn't care if it's all weight is weight. So it's one of those things where body composition doesn't matter. It's physics, right? So it stresses into the knee. So frankly, one of the best treatments for knee arthritis is losing weight. What we've seen in the literature is that even just a 10% reduction in weight actually reduces symptoms 50%, and that's pretty consistent across multiple studies. And a 5% reduction is roughly 20 to 30%. So simply losing weight can help with a lot of symptoms if that's for you. And so if there's been a reason to start a program, this is it too, where again it can help address those knee symptoms. Running comes up. You can sit up if you want. Just sitting here hanging out. It's like just do some more, right? Running often comes up as well. It's another one of those things that's a myth regarding inappropriate stress to the knee. Running is actually fine. Running consistently over and over again via long-term studies has not been shown to increase the severity and incidence of arthritis. The only time it may be contraindicated is if there's been a specific injury to the knee, and that would kind of take a case-by-case basis on whether or not running would be appropriate for you. But absent there being a specific injury to the knee, running should be fine. In fact, running can, again, be protective against those effects of arthritis. So keep running. Again, if it hurts when you're running or there's swelling, that is an indicator to probably pause and maybe seek some advice about how to move forward. Generally speaking, what we know about the knee too is if you're getting pain with running, the first advice, if you're going to continue to keep running, that is to change your cadence. And so if you're walking fast or running, we actually want to just increase that frequency because that tends to reduce the peak stresses that are put in through the knee joint as you run. So going faster turnover, not necessarily faster as far as velocity, but just a faster turnover oftentimes reduces symptoms significantly. And that's true for front of the knee pain too, not just arthritic pain. Also, modifying your striking pattern. So if you're running and you're really heavy on striking with your heel, and this is common with most normal shoes where there's a little bit of a heel lift in it. If it's not a zero out shoe where it doesn't have a heel lift where it's completely flat, we tend to strike with our heel. And that will just increase some of the peak force in the knee. Now, most of the time, that's not a big issue. But if you're having pain, striking with a midfoot pattern. So when you land, it's a flat foot. That can reduce some of those symptoms. And last piece of advice would be to, I like to say, run like a ninja. Right. So real quiet. Right. It's literally that conscientious thought of soft landing. Let your body kind of dynamically accept that weight. And you have less peak forces because of that quiet, soft landing. So increase the cadence. Again, literally 5-10%. Use a metronome to kind of track that too. We can talk about that more in the comments if we have specific questions about that. But increase the cadence, 5 to 10%. Midfoot strike pattern, and run like a ninja. Okay, so squats are fine, lunging's fine, running's fine. Again, but if you're getting symptoms, pain, and especially joint swelling with any of these things, that is a moment to pause and probably seek some advice and care from a medical professional, PT, on how to proceed, because it may be the way in which it's performed. We do know that of the different ways that arthritis may present itself, oftentimes it's just a mechanical overload issue. So we're putting stress into the knee in a way that's putting extra stress on one compartment that it's not tolerating. So if you modify the stresses into the knee by changing your joint position, you can oftentimes mitigate those symptoms and keep going with a lot of your activities. And that's the point. So you can continue to live life, do the things you want to do, and not have as much pain. What else are I going to talk about today? Surgery, I think. Again, I'm not a surgeon, but I always have to touch on surgery with most of these things. Common, right? Total knee replacement. In fact, the rates are significantly increasing over the last 10 years. They're about 4 times higher than they were 10 years ago now, just as far as the rates. So more and more are being performed, and they're getting real good at them, to be honest. Typically, what will be at least the Academy, the American Academy of Orthopedic Surgeons, their criteria for if you're a candidate or not is definitely diagnosed and confirmed late-stage arthritis. And so when we have true bone on bone, and that term gets thrown around a lot as far as arthritis goes, but bone on bone means that literally all of the cartilage has worn down in one specific compartment of the knee, where the bone itself is now exposed. And when we get to that level, typically there will be symptoms constantly. So if you're not experiencing constant pain, if it's intermittent, it's likely it's not bone on bone, because the symptoms themselves are still coming about because of tissue inflammation and damage within the joint. But the cartilage itself in the knee doesn't have a blood supply to it, and it doesn't have nerves, and so cartilage doesn't give you pain. So when we have knee arthritis, even when it's fairly severe, but if it's not complete bone on bone or grade 4, your symptoms are coming from the inflammation within the joint space itself, and not the actual cartilage damage. It can't refer pain that way. But once the bone is exposed, it can. So if there's constant kind of unrelenting pain, that's again a criteria for potentially being a surgical candidate. As well as pain that will reduce your function. So it has to have this functional component too, not just pain that's present. Those are frankly, that's it. I mean, and that's why it's pretty simple to get surgery if you need it, because it's like, well, you have pain and you have confirmed arthritis. More than half of us, by the time we turn 40, we have confirmed arthritis in our knees if we take an x-ray of it. But it has to be to that level of severity. There are many things you can do. I've talked a lot about exercise today. We talked about weight management a little bit too. Sometimes using an unloading brace in the knee can be helpful too, where it gives pressure to kind of open up one side of the knee. That can be helpful too if you are a responder to mechanical loading of the knee. So again, if you just do certain activities frequently and that's what makes it worse, the brace can be helpful. Supplements, that's a touchy topic, right? Some people swear by them. They take their glucosamine or chondroitin and they're like, I'm good, right? It's helping me stay active. Well, for some people it might work. What the American College of Rheumatology has ruled is they actually strongly recommend against glucosamine and chondroitin because of the ineffectiveness across populations. So pretty much every over-the-counter supplement that you can take orally, it's not shown to be consistently effective, unfortunately, right? It would be nice if there's kind of just a miracle vitamin or mineral that we could take that's just going to help. But as time goes on and we've researched this more and more, it seems like the vitamins and the supplements don't seem to have an effect, which makes sense because frankly, when we ingest them, chondroitin itself is actually broken down the stomach. It doesn't even reach the body in its normal form anyways, but most of the building blocks of these supplements themselves, when we digest them, they're just broken down to the component parts. And so you now have just the basic building blocks of those minerals that are there and present if your body needs them to produce it. But the glucosamine doesn't go directly into the joint magically and say, hey, heal this. Your body will decide kind of what's going to be worn and what's going to help be repaired, right? And some of that is dictated by the types of stresses that you put into your knee. So most of the supplements, unfortunately, not super effective. If we have more questions about supplements too, there's a whole bunch of information from specifically the American College of Rheumatology that I can share in the comments, but unfortunately that's kind of the truth of it. I think that was most of my stuff today. I think we wanted to touch on running, squats. Again, both are good. Want to dispel those myths. They're okay. Just watch your symptoms if you try them. Talk briefly about surgery, what PT can do, how activities can be modified. That was most of it. So If you have we had any questions so far? Yeah, we haven't chimed in. Cool. Okay, that was a fast one today. Before these videos, I always ask Amy over under 32 minutes because that just feels like a barometer for me. So we're under today, but hopefully you found this helpful. Hopefully this was good. And if you didn't get a chance to view this live today, leave your comments with questions, and I'll get back to you as quickly as I can with those. Join us on Wednesday for hip bursitis, so lateral hip pain. It's going to be a good topic too. Lots of good information with that one. And then Friday, we're going to complete our series with demonstration and discussion on trigger point or functional dry needling. So it's going to be good. It'll be exciting. So thanks for joining today, guys. Take care.